Hello, and welcome to the Tai Chi for Therapists podcast, where we are exploring the evidence and practice of Tai Chi and qigong in clinical settings. So, welcome to Series 1, Episode 1. I'm Helen Parsons.
And I'm Philip Sheridan. And on today's show, we have two guests, Vicky Jones and Liz Smith. Welcome, Vicky. Welcome, Liz. Thank you so much for joining us. Can you tell us a little bit about who you are, what your roles are, and where you work?
Yeah, so I'm Liz Smith. I qualified from University of Derby in 2024. And since then, I've sort of worked between both the acute and the community setting. And I then joined the primary care setting in January 2021.
Thanks very much. What about you, Vicky?
Yeah, so I qualified from Brunel University in 2012. Worked across a variety of different settings, including mental health, community, acute, autism, and joined with Liz in 2021 to start this primary care service from scratch.
So, both as occupational therapists, so we're really excited to interview you because it's kind of quite a new service that you've set up. So we just wanted to find out a little bit more about the setting up of the service. Can you describe how you set it up and why you picked Tai Chi as a good fit for this new service?
Yeah, so as we've just both mentioned, we joined the Leek and Biddulph Primary Care Network in January 2021. So we're covering 5 GP practices between Leek and Biddulph. When we joined, they'd obviously not had occupational therapy before. So we had quite a challenge in terms of sort of setting up the service from scratch. There's a lot of evidence base out there around the roles in primary care. So using this, we focus the service on offering early interventions and using a proactive approach to support with new conditions or new difficulties. We've got a number of programs that we offer which support both sort of mental well-being and physical difficulties. So we've got an emphasis on sort of provision of self-help materials in order to provide patients with a longer-term support. Personally, I'd tried Tai Chi in the past in outside activities and it sparked a bit of an interest. I've seen it used in sort of previous work roles, but it was very much run by sort of therapy assistants for falls prevention support only. And it was something that Vicky and I had both had a bit of an interest in, and it sparked sort of looking into possibly could we use it within the primary care because it's very holistic based. And we needed so much evidence out there to support the use of Tai Chi.
You want to add anything into that, Vicky?
Yeah, just similar to Liz, I'd had a few goes at doing Tai Chi and qigong just in different sessions in the community over the years, and found it kind of really interesting. And when we started this, we wanted to look at kind of getting in there early and holistic strategies for long-term conditions, preventing them before they get created, really. So it was something that we had, Liz obviously brought it up and we had both identified that that's a great idea. And I've got previous background as a yoga teacher as well. So I was able to bring a little bit of that kind of knowledge into kind of, running groups and working with, groups of people with a physical kind of modality. So that was kind of the basis of it, really.
Because I believe you're in 2 different sites, is that right?
Yes, yeah.
Different sort of setups in terms of how you deliver and how you see patients. And I think that's really interesting because you've had to be really innovative in what you've done.
Yeah, so we kind of work as a team across the 5 practices. So we're not kind of really separate as an elite team. So we kind of field the referrals that come in as a team, whether they come from the Leek practices or the Biddulph practices. And setting up the service, we, like as Liz has mentioned, we look at a range of different treating. We're not just focused on frailty. We look at frailty, pain, fatigue, mental well-being, lots of different things. And we're looking at that early intervention criteria. So something when it's just started, what can we do to stop it from getting worse or developing, getting people off work or, before it kind of develops comorbid conditions, that type of thing. So once we had the idea for the Tai Chi, what the first thing we did was gather the evidence base around Tai Chi as a health intervention. So we just had a look at different research. And again, that was looking at research that had been done on mental health conditions, chronic pain, falls prevention, around how Tai Chi had helped with those conditions. So the first we did is have a look at kind of, is there evidence for this being useful for people? So we could then put in a training request to do yourselves a lovely training to get us qualified and confident and to be able to deliver these sessions, because it's all well and good having the idea and having the evidence, but I think you need a solid kind of training ground as well for being able to deliver it. So once we'd had the evidence, put in a training request, we then put together kind of a protocol for how we were going to run these groups. So we had some inclusion and exclusion criteria. So obviously some of the people we deal with are housebound, so it had to be that they were able to get themselves into the community, into the clinic or into the community room to come and actually physically do the Tai Chi. They also had to be under the occupational therapy team already. So we didn't want kind of word getting out there and it just being a free-for-all with people just wanting to come and do Tai Chi for free. We needed it to be kind of as a therapeutic session rather than a Tai Chi group they may just do in the community. So they already had to be under our services, and then we would identify whether or not that would be an appropriate intervention for them. So then we identified we'd need 2 staff to run the group. Obviously, if something kind of happened to someone needed first aid or assistance in any other way, they would be able to deal with that, and then the other member could kind of continue to run the group. We did risk assessments for the rooms and the environments that we were using, and we'll come on to this in a little while. It was a little bit easier for me because I was in a medical centre, and so a lot of the access needs were kind of taken care of, but we identified any kind of risks that would be kind of associated with the environment we were running these groups in. We kind of identified how many weeks we were going to run them through, which would be 10 weeks to start with. I think we've shortened that now, but I think we used one of the evidence, one of the articles, the research articles, one of the trials was on a 10-week period. So we thought we'd start with that. And we just kind of went from there, really. We chose an outcome that we would use, which we would do in the first week, called the MIMOP, which is measure your own medical outcomes, I believe. Yep, I might have got that right. So we would get a baseline of the participants' symptoms. So that looks at symptoms, and it also looks at how those symptoms affect functioning, which is obviously kind of an OT kind of aim, is what we're looking at how to kind of improve functioning. And then we do that outcome again at the end. So the person kind of fills it in again and gets, we are able to measure then any change that's happened with symptom reduction and with improving activity levels. So I think that's mainly kind of what we kind of covered for kind of setting things up. I don't know if there's anything else, Liz, that I've missed off.
The only thing I've got down is that we provided a personal copy of the movements.
Right.
Yeah, to patients. So it provides like self-directed learning resource as well, and it enables them to engage with the exercise independently in their own time at home. And obviously, we know that we can sort of give sort of personal guidance with that in the sessions, but it enables patients to then utilize those movements on their own at home.
Good stuff. I mean, it shows just how comprehensive our pre-planning stage is, doesn't it? And that there's a lot of logistics really to think about.
Yeah.
How long did it take you, out of interest, from the idea of setting up this service to getting it off the ground? How long roughly did that take from you having the idea of the service to getting it running, would you say? How long was the incubation period?
I think it was different for both of us, wasn't it? Because I had access to the room much quicker, because I run it from the medical centre, which has got an activity room. So once I'd done the training, I was pretty much up and running to, I just emailed the person who was in charge of the rooms, and they said, we've got it from this day, this time. So I was able to kind of get there sooner in Biddulph, whereas I know Liz had to source a room because there isn't the same kind of resources for the GP practices in Leek. So it took a little bit longer. But I think around kind of 2 months from getting the protocol ready and doing the training to starting for me, and then probably 3 months for yourself, Liz?
I think it was about 3 months, because for Leek, it was a little bit more different because we didn't have sort of in-house rooms that we could use. Obviously, it's quite difficult because it needed to be a space whereby it was accessible. We'd got parking, that there was toileting facilities, and that there was no cost implications as well because that. So we've been very, very fortunate that our business manager managed to source through Sainsbury's in Leek. So I must shout out to Sainsbury's in Leek to say thank you. It's an ideal space for us. Not only have we got car parking, we've got disabled access. There's perfect toileting facilities as well. And actually, it's a really lovely room to run Tai Chi from because we've got floor-to-ceiling windows with the most amazing outlook on Leek. So although it was a little bit longer of a wait for us to kind of start in Leek, we have now got a brilliant facility and it's working really, really well. So we've been very thankful for that opportunity. You just don't know. It's quite difficult. And I think that's probably one of the biggest challenges for me in Leek was finding that sort of ideal room. There was a few options, but then we didn't have parking for patients, which is quite important. And it's taken into consideration as well for many of these patients. It's quite anxiety provoking coming to somewhere for the first time. At least with Sainsbury's, it's a known quantity. Everybody knows where it is. Everyone's been before. And so it's sort of a safer option, I think, for people.
I think that sounds a really good idea. Again, that first crossing of the threshold, as you mentioned, Vicky, sorry, Liz, is such an important step for so many people. And again, the way in which you've tried to kind of knock those barriers down or make those barriers as easy to cross as possible is really admirable.
Yeah, I love that out of the box thinking of picking a supermarket because we often have know how difficult it is to find level access, where it can be easy accessible. And I think, is there a lift in that venue? I think you might have mentioned.
Yeah.
So it sounds like a beautiful space, but also you've got a lift, like you say, you've got nearby parking, and like you say, you've got this already, the barrier of being somewhere new or unusual, or just taking it away from a hospital or healthcare environment. Like reframe, can't you, an intervention?
Absolutely.
I love the two options there that you've got, completely different feeling. So do the groups work slightly differently now because you're in different types of venues, or do they run along similar lines though?
We follow the same protocol, don't we? Really, I think.
We've got the same set of moves that we're delivering, and it's the same sort of information pack that we give to patients for both Biddulph and Leek. So there is similarities. So it helps because there is always that option if you've got a patient that can't get to Leek, they might need to go to Biddulph. So we've got that flexibility between the two groups if it's needed.
Excellent.
Oh yeah, that's a really good option, isn't it? That they've got they can go to two different venues. That's brilliant. And so, can you tell us a bit more about a typical patient that you might see?
Do you want me to go on to that one?
Yeah, whoever wants to take that question first.
So as Vicky's mentioned, we run a range of different programs, sort of covering lots of different symptoms. But I think the biggest cohort of patients that we're often referred are patients with pain difficulties for the pain management service. And we know that quite often when you're dealing with chronic pain, often medications are not effective on a long-term basis. Therefore, holistic treatments can offer the best outcome and support for this patient group. Having this ability to kind of offer Tai Chi has been an amazing support option. It also sort of increases inclusivity to patients with pain difficulties as well, because it's an exercise that can be completed by anybody. And the fact that it's adaptable as well, you can support patients that can't stand to do the moves, that need to sit or even supported standing. So it was a brilliant sort of option to help with this cohort. Actually, I've put together sort of a little case study just to sort of share with everybody.
Fantastic,
So a gentleman, I'm going to refer to him as Mr. T, who has given full consent for me to discuss him as part of this podcast.
Wonderful.
It was a 61-year-old gentleman who was referred to the pain management support following a major trauma accident about 12 months ago. Initially, we sort of provided a 6-week program of pain management, which was completed face-to-face at home. And we worked through sort of a number of different sort of support strategies before we then sort of offered him a place in the Tai Chi group. He completed the full 10-week program with us. He was able to complete all the moves in a standing position, but because of sort of ongoing pain issues on his left side, we had to sort of limit any of the movements that involved turning just to not exacerbate those pain symptoms. There was a few adaptations made with some of the movements. We completed the mind mop with him, which Vicky's already made mention to. So symptom one that he wished for support with was sort of around the injury, nerve damage and back pain. Following completion of the course, he reported a 50% improvement in those symptoms. Symptom two was well-being. As a result of what he'd been through, he'd had a really difficult time. He'd been on ICU, multiple surgeries. He'd gone from being an extremely fit gentleman to a gentleman that was very limited with activity. So his well-being had taken a big sort of knock-on effect. Following the completion of the groups, he'd reported a 75% improvement in his well-being.
Wow.
Yeah, absolutely. I mean, you could tell he thoroughly enjoyed those group sessions. And as an activity, he'd mentioned that physical activities such as gardening and just general tasks around the home had been hugely sort of impacted on. And he'd noticed a 50% improvement in those activities following the groups. And when we'd sort of asked for a little bit of feedback, he verbally fed back that the Tai Chi groups had really helped him with his confidence levels. He'd really looked forward to sessions each week, and he loved meeting new people. He's reporting that he's using the moves every day at home, and he continues to really enjoy these exercises. And it's not just the physical exercise element, it's the relaxation benefits that he's found from those groups.
What a tremendous set of outcomes. That's just remarkable. It's a case study that really resonates with me, because that case study could describe me very much in terms of a very serious trauma patient. And I can relate to those impacts very, very, very well. So, really kind of heartening to just hear how even in a very relatively short space of time, 10 weeks, that's such a dramatic improvement in terms of quality of life. Simply remarkable.
Fantastic. Do you want to add anything more to that?
Just that a lot of the patients that we're seeing are feeding back that they've got improved confidence, really, whether it's in mobility or pain levels. I think a lot of people come to the group for one thing, whether it's pain management or improving balance or mental well-being, and they see knock-on effects. So they see something else improving in their life. So it's kind of, they start to realize how much the pain was dragging them down and how much lighter they're feeling, or they feel how much more confident they are because their balance is improving. They're going out more and their mental health's improving. So it's not like it just treats kind of one small thing. It's a really holistic approach and holistic outcome that a lot of the patients are reporting on. And I've signposted a lot of patients to community Tai Chi sessions because they've wanted to continue it, and they've wanted to continue it in a group setting. So they're quite happy to go and kind of pay for sessions and continue that in the community. So yeah.
That's wonderful that you've got the option in your community then that they can carry on doing something that's been really empowering for them. They've been able to take control in so many different aspects of their life. They're able to kind of, get back an occupational identity. And sort of Mr. T, he was kind of thought of himself as physically active, and he was able to get back to that. And that, or just kind of just realizing how much your life gets diminished without perhaps realizing it. Sometimes it sounds like, when your balance starts to, it starts to, you can get loss of problems with your balance and loss of strength and all. They can bring all these back through one intervention like Tai Chi. That for us kind of makes our hearts sing, doesn't it? Because we love to hear all those active ingredients in Tai Chi coming together. The active relaxation together with the strengthening, together with the balance elements. And you also mentioned about that social interaction, and for us that's a big part of one of the active ingredients of how you talk about what will be the social interaction. You mentioned there Mr. T did really enjoy his getting out and about and meeting people again.
He did, and sort of other sort of verbal feedback that we've had from sort of patients, it's coming through quite strongly that it is that group setup. So we've had a number of comments about the group session, the settings help with confidence, that being in that group setting with other members has really sort of helped that enjoyment level. It's made it fun. It's helped from a relaxation perspective. A lot of people have sort of said that it's help them kind of break down those barriers of perhaps trying another group and joining another Tai Chi group in the locality. But I think one of the sort of unexpected outcomes that we hadn't expected was that there's been quite a social gathering of these people that have come together for a few weeks and have continued to meet up after. So for me, at Sainsbury's, it's ideal because there's a cafe just outside the room. So quite often we'd clear up, and as we were leaving, they were all in there having a cup of tea after. And we've been sort of aware that there have been some patients that have been meeting up in each other's homes and doing like a little Tai Chi DVD together. And that, although we knew that there's so much evidence to support running things in a group setting, I think the fact that we're seeing those sort of results of how important that group has been and how meaningful to these patients, it's been utterly delightful to see, and it's offering more therapy ongoing because they've got that long-term sort of setup and social network that they didn't have before.
Fantastic. I think, yeah, again, we love the fact that Tai Chi can be something that you can share with others. You can, sometimes you can share it with friends and family, or you can share it with new friends. So they've had new friendships, and they've kind of got this newfound interest, this new kind of occupational identity as someone that does Tai Chi. And again, for us, that kind of helps. We know we can help, that can build into self-efficacy concept. That idea that, yes, I'm not just somebody with a long-term condition, but I'm somebody that actually, does something physically active that can really have a knock-on effect, can't it, in terms of, like you say, our well-being, but also our, ideas around our ability to self-manage our condition. So much going on there, interacting together. Really is a multimodal intervention in a way. Would you say that? So, it's kind of...
Yeah, definitely. And I think a lot of patients that have been hesitant about coming to the group, I've had some patients who've been a bit like, it's really changed their own perception of themselves from somebody who just doesn't feel that they'd be able to, I've had patients say, I can't do that, I can't come and do, because of they've had ideas about what it would be, and they're just ideas about their own competencies and themselves, because they've had these conditions that have changed that narrative of themselves. They've come and that's been transformed, and they've the feedback they've given at the end is that I'd do more of this, I'd go to more groups in the community. So it really does challenge patients' perceptions of themselves from living with a long-term condition.
That's kind of quite remarkable, isn't it? That set of expectations there before coming to the group, and as you said, that's a great word. You've ended up transforming those expectations and actually opening doors in many respects to how people, as you say, perceive themselves and what they then think they can go on to. We often sort of talk about this, I think, on our course, don't we? This idea that we're hoping to promote that self-efficacy and autonomy, and hoping that Tai Chi can in some ways be a gateway activity to kind of further exploration. And you guys have really captured that so nicely as well.
Brilliant. Anything else you want to talk about the outcomes or benefits that you've seen for patients?
Well, like I said before, we use the MyMop, so we're kind of getting a baseline of kind of how things are improving for people. So that measures symptoms. We can put up to 2 symptoms and an activity on how the symptoms are affecting their ability to do the activity. We found participants generally improve on 1 or more of those symptoms, and then this has that knock-on effect of improving on their occupational functioning. And allows them to just kind of meet any goals that they've set kind of with their overall program that they're on, whether it's fatigue management or pain management or whatever. It's kind of helping them achieve those goals. One of the MyMop questions is also around reducing medication. And we've lots of patients who've reported to feeling able to manage their pain more, usually around pain medication, isn't it? So they reduce their pain medication through the Tai Chi. So it really depends on the patient, that one, in terms of how much, or if they're able to at all. But even if they're not able to, they just feel more able to kind of cope with what's going on with them kind of physically, I think, through the Tai Chi. And I think, Liz, you've got some kind of stats on kind of
because we've got alongside the MyMop, we've got another little survey that goes out, which is sort of led by the PCN, and so that's been collectively sent from both the Biddulph and the Leek groups. And the results to date, we've got 50% of patients strongly agree that the sessions have enabled them to meet their personal goals that have been set. 87.5% of patients have reported that they'll continue to practice Tai Chi, either using the work packs that we've provided or the information for other groups sort of in the community. And we've had 100% response that patients have said that these sessions have been hugely beneficial to be able to access them as part of the treatment from the Leek and Biddulph PCN.
Wow.
So it speaks for itself, really, doesn't it? It's obviously,
amazing.
hugely successful already, which is it's lovely. And then we've had some verbal feedback as well. I think this was one of my favourite ones, that these types of sessions are much more positive therapy for me than just being given medications.
Goodness me, yeah. So you've got some amazing testimonials there and tacit bits of feedback, haven't you? I'm really quite taken aback that again we have our anecdotal bits of feedback over the years, and they are really quite humbling, aren't they? In of what we do, and so you must feel really quite proud of yourself. And I'm very pleased with those outcomes as well, because those are not just minor kind of movements of the needle, are they? They're significant improvements, again, in people's quality of life and their sense to be self-managing and feeling confident in that. That's just quite amazing.
Yes, so just to kind of quickly reflect on going back to the beginning, it didn't take a huge amount of time to set up. You were using resources that you already had there, so using community rooms or rooms in the building that you already had. Were there any other resources that you needed to get going, or did you feel that it kind of went quite smoothly in terms of setting it up and getting to this? Because like I say, I'm a bit overwhelmed. Like you say, you've had some great responses and it feels like things have moved quite smoothly. But I kind of want to know, kind of perhaps behind the scenes, there were other things that were a little bit more difficult, or things that you might do differently, or top tips that you might give to other health professionals if you were to kind of suggesting, if they were kind of really, again, amazed by the results and want to try something like this themselves. What sort of things, what might you say to them that you've learnt on your journey?
I mean, I think one thing that we'd sort of perhaps overseen initially was that we'd not got our photographs of the moves done first to have put the patient packs together. It was like a bit of a work in progress as we started and rolled out the programs. But actually, we've realised that how important those guides are for patients, and they're offering really good support to them. I mean, another thing that we're sort of looking at is to video those moves as well, because for some patients it's really difficult to kind of, you've done it in the group, you've come away and you're like, oh no, like how did that go? And even the written word, it can't always be descriptive enough, can it, to help with those movements. So that's something that potentially would have been really useful to have had as a resource before we started the groups. I mean, in terms of sort of advice for sort of setting things up, I think liaise with other, practitioners that are using sort of Tai Chi in their practice. Look at different training options, because we'd explored, a number of them before we'd found sort of discover Tai Chi. But I think for us, it was that therapy kind of led element that we knew would really sort of help support our development and be, the best option for our patients. To look at all the evidence. There's so much evidence out there. I mean, I think we were sort of quite amazed at how much there was. And you can use that to sort of support your applications for training, and it adds weight to those documents for, requesting. And putting a good solid protocol together to use in practice. I think, as Vicky mentioned before, it's having, boundaries of, sort of criteria in terms of who can access those groups, because if we just open up the doors, we would have just been completely inundated with referrals for Tai Chi. So obviously it's sort of looking at, well, how can you make it work best in your practice? How to sort of support with your own sort of work, because obviously for us, we've still got our community side of work as well. And also the locality needs, as well as looking at the type of patients that you've got in that local area, and what would best support them.
Those are super points, and you talked about the evidence, and you've kindly given us some of the references that you kind of made use of, which we will put into the show notes So we will have some show notes to accompany this podcast, which will have some links in there. And as I say, we've got those references. But yeah, once you begin to dive into the research into Tai Chi and Qigong within the rehabilitation realm, you begin to realize that you can go down a rabbit hole very quickly.
Absolutely. Yeah.
How did you sift out the wheat from the chaff, so to speak? What did you look for when you looked at some of the research to kind of support your rationale?
I think we were focusing mainly on the conditions that we are looking at as a service. So we were really looking at, you know, we didn't want to just look at Tai Chi, one thing that it looks at, obviously, and it's looking at kind of other things that might be impacting that patient's improvement. So you know, if there's kind of a control group involved where you can clearly see it's Tai Chi or the medication that's helped, or is it just kind of a review of Tai Chi being involved alongside other things? So it was really kind of looking at it in detail, and looking at how it affects many different conditions to just see, you know, kind of how we can kind of then educate the people coming as to why it may be beneficial for them, if we can try and translate some of that research as to why it might be effective, and that there has been studies done on it, and kind of what's that look like at the end. So yeah.
Fab stuff. Thanks, Vicky.
Okay, so we're kind of slowly coming towards the end of this episode, but we just kind of want to get a feel from you. What's next? I believe there might be a conference. Is that right?
Yeah. So we've been inundated with queries and questions since we had an article published in the OT News, which was utilising the Tai Chi and utilising acupuncture as well, so kind of Eastern modalities within the primary care service. And since that was kind of published, we've had lots of messages from different OTs asking about the questions that we've talked about today. How was it set up where we did the training, how we've measured outcomes, how many staff are needed. So we've been feeding back to a lot of our colleagues who've been messaging us. We did there was a Royal College of OT network meeting last week, and one of the OTs brought up that article and said that you know, she'd seen that and she then wanted to develop it in her service. So it's really kind of providing kind of across the UK kind of a lot of food for thought, really, as to what's possible in primary care. We were contacted by the Royal College specialist section neuro conference people to deliver a workshop there on how we're doing the Tai Chi and how it's effective in our practice. So we're going to be going there in October or November, I believe.
October, yeah.
To do a little workshop and provide some information about how it's helping patients in primary care. And yeah, I think we're just going to plan to develop that further. Hopefully we might be kind of putting together something to try a little abstract together for the RCOT conference next year, see how that goes, if we get skilled up in our conference speaking. But yeah, it's
amazing.
All going well.
Do you have any inkling that you would have this kind of wider impact at the beginning?
No, we've been very overwhelmed.
Absolutely. I mean, I don't think we thought that the article would even get published. We'd always talked about writing an article because the roles are very new and they're emerging roles within primary care. So it was something we were keen to do. And we felt very much that this is quite a unique sort of offering that we've got. And that there's a real need to kind of sort of promote the use of holistic practices that to move away from the medical model, especially in primary care, because as I've mentioned before, like the medical model it's not inclusive, it doesn't support all patients. And there is that need to kind of like utilise our OT skills in other ways to sort of help this cohort of patients. So yeah, it has been quite overwhelming. We weren't expecting it. But it's watch this space, really. We're not quite sure where it's going to go next. It's each week there seems to be something else, and we are looking to sort of video some of these moves. We're very thankful to Biddulph Grange Gardens that have offered for us to use their Chinese inspired garden to video these moves so that we can kind of outreach to patients that can't get to groups, to sort of add to that inclusivity of the service. So that's something that we're working on at the moment as well.
Awesome. Well, I just want to say congratulations, guys. I mean,
Thank you.
it's an amazing piece of work, and yeah, hat tip to you guys as well.
Yeah.
Really well done. Yeah.
Yeah, it's been fascinating. Thank you so much for coming along and sharing your story with us, coming on the podcast. Like you say, we know you've had lots of interest, and we hope that this will spark a bit more interest. And so, you're happy to answer questions if more people want to get in contact. Hopefully, we've got a lot of the answers there in the podcast for them. But should they have anything else, it'd be great for them to get hold of you. And hopefully, they can also go to the ARCOT neuro specialist section. You'll be there, and hopefully we'll see you at the conference, ARCOT conference next year, onwards and upwards. So anything else you kind of thoughts that you want to leave us with about maybe where you're going next, or how this journey has been so far?
No, I think we're very grateful that we were able to attend your training. It was very kind of useful for it. So yeah, thank you.
Absolutely.
Yeah.
No, when we set out on the journey of creating the course, we're unsure where it would go, but we were very clear that it wanted to be very situated within that clinical practice, based on evidence and based on clear rationales. And you've kind of just demonstrated that by the bucket load. It's a tremendous story you guys have got here, and yeah, long may it continue. Can we have you back in 12 months' time to find out where you are?
Yeah,
I mean, love
yeah,
it.
yeah, it'd be lovely. Thank you.
So thanks again for joining us. We'll make sure that we link to the ARCOT article so people can check out the show notes for that. They can check out the show notes for references to the evidence. We're going to have a little bit more information and some little infographics for you to have a look at. So yes, thank you again for joining us. It's been wonderful to hear your journey, wonderful to hear your story, and we just wish you all the best for the next part of your journey.
Yeah, Vicky, Liz, thank you so much for joining us on the very first episode of Tai Chi for Therapists podcast. I've been Phil.
And I've been Helen, and it's been a pleasure to have you. So thank you so much for joining me.
Thank you so much.
Thank you.
Thanks, guys.
You've been listening to a Tai Chi for Therapists podcast. If you'd like to find out more about our course aimed at rehabilitation professionals called Tai Chi for Therapists, then please visit our website at www.discovertaichi.uk.